It took me almost 4 or 5 days to feel my legs again. But I was lucky. I didn't fracture anything. I didn't sever the spinal cord, just had massive swelling and damage to the disc. So that started me on the path. I got put into the medical ringer. I got put on that conveyor belt where, you see the ortho, then you see pain management, then you see that, your primary care, then you go to PT, and then, before you know it, I'm under 4 or 5 different doctors' care getting ready for surgery. In the process of the insurance getting me pre-qualified for the surgery, I started to get some second thoughts. About the fourth or fifth day, I started to get some feeling back in my legs. So there was just an internal voice inside that said, this is not the right path. Like this medical model, even though it was an emergency situation and I was all for the surgery out of the emergency, over that first week, I started to heal a little bit, even though the pain was excruciating. So long story short, I wound up not getting the surgery. It took me 2 years to recover and walk again, fully walk again. I was able to stand after a couple of months, but fully walk again. Never had the surgery. I've got multiple disc injuries. I've got cord compression. I've got stenosis. I've got arthritis, but I'm functional. So not to say I won't ever have the surgery, but it put me on a path at a young age to see that I had to be responsible for my health. Because if I laid it off on the doctors, I was on oxycodone and Oxycontin within like 24 hours after the injury. I was on morphine, and there was really no end cycle for the pain med. I could be on pain medications my entire life if I wanted to, and I would have had a good excuse. So of all the things I learned in that whole experience was to going from being the victim to the survivor. And right now, most of us who are in healthcare right now, especially in this crazy times right now, is that most of our patients are stuck in victimhood. So the primary thing I think a lot of the healthcare providers who are moving the needle the most and getting the best results is coaching our clients to now become survivors. And just that little shift from having gone through that myself was probably maybe the most profound thing that has ever happened to me to be successful in practice, other than having empathy for patients and knowing what it's like to actually be a patient with no hope and not feeling like I'm ever going to, heal myself again. But going from victimhood to survivorship is probably the most powerful lesson I learned through that whole ordeal.